Is Botox preventative? The answer is yes, if you use it regularly. So what we found by looking at twin studies, and there's been one really interesting twin study where one twin was in Germany and one was in California, and the California twin had like 20 years of regular Botox to her forehead and her glabella area, and the other twin never had any. And there was quite a striking difference in how they looked in terms of aging after 20 years. So why does that work, or how does that work? So Botox, or anti-wrinkle injections, they work by stopping you from being able to use a muscle. So they don't like paralyze the muscle, as some people say, but they just stop you from being able to use it, which I guess you can say is paralysis. But yeah, basically stops the nerve endings from being able to activate the muscle. So when you do that, you can't, for example, raise your forehead. Like I have Botox in my forehead. I can raise my forehead a little bit, but not enough to create any lines. So you can't see any lines, and I can't really frown. So I'm not creating any lines there either. Same with around my eyes. I have it there as well. So basically what that does is, if you cannot create those lines, over time you won't develop the static lines or the indents, the wrinkles that you would get with chronic use of a muscle over many, many years. And that's how Botox is preventative. Now that would work if you continuously do it. So Botox lasts somewhere around 4 months, and then you need to do it again. So it is a commitment over time. So like 3 times a year you have to have it done again in order to kind of maintain that effect and keep it looking good. Now a lot of patients then say, well, if I stop doing it after 5 years, am I gonna immediately just look really old again? So no, you won't, because you won't have created those lines within the skin due to the chronic use of muscle. So if you just stop doing it after 5 years, you would just very slowly over time, many, many years with use of the muscle, get wrinkles. But you wouldn't like suddenly become old looking, if that makes sense. So Botox is preventative, but it does require commitment. So it's a financial commitment and a time commitment. But of all the things you can do for anti-aging in terms of, in-office procedures, Botox is probably the best one. I like a fractional CO2 laser as well, perhaps a little bit of filler, but really when it comes down to it, the best bang for your buck is gonna come from anti-wrinkle injections. And that's what's gonna, do the trick.